Welcome everyone to our series on the moral imagination in crisis. Today's is particularly important because we are going to speak with two incredible human beings and Acumen Fellows, Niniola Williams from Nigeria and Abdal Mufti from Pakistan, because each of them make manifest the idea of collaboration across lines of difference and this notion that to solve something as big and as pervasive as a pandemic requires new kinds of collaboration, certainly this idea of partnering with both humility and audacity. And when we're seeing leaders all around the world doing just the opposite, focusing on competition and too much divisiveness, it is extraordinary and powerful to see the kinds of role models that we see in Nini and in Abdal. And then second, to understand, I believe the more I'm hearing from members of our community, that the kind of innovation that will make change into the future is going to come from the roots up. And so I couldn't be more excited for this conversation. I'm going to let Niniola and Abdal do slightly more introductions in themselves, but we're putting their bios in the chat so that they don't have to spend a lot of time on it. Instead, we're going to ask each of them to talk about what's happening in their country. What are they doing in terms of addressing the immediate needs of the coronavirus crisis? And how do they see healthcare in Nini's case and education in Abdal's case going forward? So let me start with Niniola, a Nigerian fellow whose aunt was at the forefront of fighting the Ebola crisis and lost her life in doing so. Niniola then stepped forward to build an organization that would work with government and other organizations so that Nigeria would be ready for this pandemic and any other pandemics that come along. So Niniola, welcome, and I'm going to turn it over to you.
Hi, everyone, and thank you, Jacqueline, for the invitation to be here. It's great to be part of this conversation at such a crucial time like this. So, as you said, I run a public health organization which was birthed after the hardest thing that I can say I've ever been through, which was the loss of my aunt. And as you said, 6 years ago, she found herself face to face with the person that ended up being Nigeria's first ever Ebola patient. And in the face of that danger, she did her duty as a doctor. And her exact words, which I can never forget, were that she was doing it for the greater public good. And that's essentially what birthed or started this idea of this organization. How do we build our health sector, fill in the gaps, address the challenges that we have and strengthen the sector? And when I say the health sector, it's really made up of people, right? So it was about how do we invest in human beings to make the changes that we needed and to see the things that we wanted to see. And so we do that through partnerships and collaborations, which is why, again, this conversation is so important, because that's one of the founding principles of my organization, that we can't go very far alone, but together we can go faster and we can go further. And so our focus is on areas like hygiene and sanitation, infection control, and general health emergency preparedness for a time like this. So our programs, we have community-based programs, we have health and facility-based programs. We do programs at the various points of entry, the airports and seaports as well. But it's all about building capacity and investing in human beings to see the changes we want to see in healthcare.
So thanks, Nini. What are you seeing in Nigeria, and how are you and the country not just preparing, but dealing with what's happening?
Yeah, so Nigeria, when you look at the global scale, we're still in the early days of our COVID-19 outbreak. We definitely expect there will be more cases. We already know we have community transmission, and we're doing our best to stop that. But in terms of how we're responding directly, my organization, DRASA, is part of the response team in Lagos State, which is the epicenter of the outbreak. And how we're contributing is that 3 years ago, we started an intense, holistic approach to building capacity in the health sector. Our goal was to empower professionals to be able to detect and contain infections. And that's not really something that's being taught in most health professional degree programs. So whether it's nursing school, medical school, and all of that, but it's so crucial. It's such an important part of ensuring patient safety and protecting public health. So helping those on the front lines has always been something that we did. And so at a time like this, we're right there alongside government trying to build the capacity of all those who are on the front lines. So from the people going into communities to collect samples from suspected patients, to the ambulance drivers who are going to bring people out of the communities into the isolation centers, to the staff that are working in the centers, the doctors, the nurses, the cleaners. We've been training, to date, we've trained over 780 people for that. But it's still not enough. We have a lot of money being pumped into infrastructure, treatment centers, ventilators, but there's this gap of the human capacity required to respond and to contain this thing. So that's really where we're trying to fill a gap.
It's great. A lot of people, including and have been coming to Acumen with ideas for ventilators, respirators, tests, and testing. And I haven't heard you talk about any of these technical sides of the issue. And are you focused on that as well for Nigeria? And why not Niniola?
Yeah, so the government has done a fairly good job of mobilizing those resources, the hardware, as I like to call it. But again, you can set up an amazing treatment center, put in all the best equipment, get all the personal protective gear, and have nobody who's willing to go in. It takes a lot of courage to do this kind of work. And, we've been reading a lot of stories of other health workers around the world that are really, really inspiring, people on the front lines, risking their lives day after day to take care of patients. But we find that here, it's a gap. It's not something that people are looking at. How do you empower health workers to be able to go and do their jobs without infecting themselves in the process? Nigeria has a shortage of health workers already. We can't afford for this pandemic to wipe out that very important workforce.
And when you look around, when we had our conversation last week, what really struck me was the leadership that is getting Nigerians to see themselves as part of a national effort right now, and that you're also pulling together government, private sector, civil society, and you're really seeing it work together, not just for now, but into the future. Could you give some examples of that, as well as some of the challenges and how those challenges are being overcome?
Yeah, so again, collaboration has been our biggest strength in this time of crisis. Seeing people from everywhere coming together, as you said, private and public sector, and putting their heads together to figure out the best way to manage this. And granted, we've dealt with a lot of infectious disease outbreaks before. We had polio, then we had Ebola, and we always have Lassa fever and meningitis and monkeypox and all the others. But this is obviously a global pandemic. It's unprecedented, and just seeing the level of partnerships and the effect of those things. So one example that I can give is the fact that we're currently in our 4th week of lockdown. And in Nigeria, we have many people who are daily wage earners. So what they make for a day is what they use to feed themselves and their loved ones. And so when you enforce a lockdown to stop a virus, you have all these unintended social, consequences. And one is loss of income. And so we are seeing people who are literally going hungry, they're starving. And what we've seen here, in pockets, in different communities, is the more affluent members of the society coming together and saying, look, we're going to put our money where our mouths are, and we're going to feed our neighbors and our brothers and our sisters. And that's just such a beautiful thing to see, because we know that government can't possibly do it alone. We don't even have any kind of social welfare systems in Nigeria. There's no social security at all. So you're pretty much on your own at a time like this. And so seeing, just on the street, people setting up food banks and getting cooked hot meals delivered to people who need them, it gives me a lot of hope that we can get through this if we do it together.
It's extraordinary, actually. really my last question, but for you right now, the when I talk to high-level people at global organizations, one of the real worries about the fact that there's so little coordination and collaboration globally is Africa, the continent. That there are some who are predicting pretty dire outcomes, not necessarily because of the disease, but because of all the social determinants around it. You talk about income, but will there also be no access, which can lead to deaths and also violence and disruption all across the system. Credit, farming, the whole thing can ripple. And is that a conversation that you all are thinking about? How are you planning for the future, and where does partnership and collaboration within the country and across come in, Nini?
Yeah, I think that's a very, very important question, because of course we're now in firefighting mode, right? We're looking at how do we stop what's currently the biggest threat, whereas we also need to be thinking about building a resilient society for the future, because we know that, as you said, there's so many other things that are already being affected by the virus. And so definitely one of the biggest things for me is that what's happening this year across the world has shown us how interdependent we are, how much we need to work together, how much we need to collaborate and learn from each other to be able to improve and be better on the other side of this. And when you think about, like for us in the health sector now, thinking about what is the health sector going to look like after this? I see a future where we have a health system that's prepared, ready to protect and safeguard so that we don't ever end up here again. And, what I see as that future is something that can only be attained if we partner together. We as DRASA alone can't do it. We need to build relationships and connect and get support. And I think that's the same for every country. I used to live in America. I came back to Nigeria to do this. And my vision for what this should look like on the other side is a worldwide vision. Because again, a crisis in one place can very easily become a crisis somewhere else. So I think more than ever, we really need to be focused on working together to get out of this.
Well, I adore you for that, as you know, this idea of a world vision, and also for the fact that you and DRASA and others are starting to put forward this idea that you can build clinics, not thinking about them as temporary just to deal with the virus, but places where either you can study infectious disease or be used for health clinics in general. And so my hope in watching you and my inspiration in seeing what Nigeria and you are doing is to see what the future can look like, not just there, but in other countries, and certainly including in the United States. So thank you. I want to come back to that, and if people have questions, make sure that you're putting them into the chat. And then I want to turn to Abdal, because education and healthcare have so many of the same issues, particularly, as Niniola said, when we've got very little safety net. Abdal Mufti is a Pakistan fellow who was encouraged by his fellow fellows to join government, and so began advising the Ministry of Education. And during the beginning of the COVID crisis, was given the daunting task of finding a way to keep education going for the 12 million public school students in the Punjab, which is a place that also has 6 to 7 million young people who are not in school, working across lines of different sectors, as well as with some of his other fellows. Abdal seems to be pulling off the miraculous. So let me turn it over to Abdal Mufti and say welcome.
Hi, thank you so much. Thank you so much, Jacqueline, and hello to everyone. Assalamu alaikum. So very briefly, first of all, I don't know if I should thank that person who asked me to advise me to join the government, or should I? Some days I really don't like him, but then there are the days when I think he may help me make the right choice. So my name is Abdal Mufti. I'm currently heading the research and policy wing of the School Education Department, Government of Punjab. I've identified myself as a education practitioner. I've been working in education for the past 7 to 8 years. started with teaching in a Teach for All program, which is Teach for Pakistan, have classroom experience and built on from there all the way. So now I'm at a more of a, like a policy level position. My role primarily is to help develop reforms for the education sector. Punjab is a very interesting case study if you look at education. It's one of the largest education systems. Nearly, as you said, 12 million children roll across 50,000 public schools in a province with a population of 110 million and a population that is very diverse. So there's significant challenges that Punjab has already faced. Keeping in mind there's still 5 to 6 million who are still out of school. So there's in roundabout, if you also take into the private sector, school children who are enrolled in the private sector, you have around 30 million children who are enrolled in these in public or low cost private schools across the province, which in itself becomes a country across the world. So it's a huge number. So coming to the what we're currently doing, so when the COVID happened, we knew that we had to sort of respond. I was lucky to be in a role, to be very honest, where we could respond, and I can share a bit of more detail on what exactly we're doing currently.
Great. Yeah, I'd love to hear it, both in terms of how you built a collaboration, what you then turned to do, because you're also in a country and in a province where there's very limited internet access, few smartphones, and as you said, an education system the size of many countries, larger than many countries. So what did you do? How did you do it? And what were the skills that you needed to make it happen, Abdal?
So I think it's very important to understand that what the response that Punjab government and now the federal government of Pakistan also followed suit. They also launched a TV channel. I think this is a major change. We historically we haven't seen governments react that quickly, especially in terms of something that's not disaster management. So I think the first instinct is every time there's a crisis that it has to be managed, and there's disaster management response. So education becomes a lesser priority, unfortunately. But this time, I think we're very fortunate that the government also reacted to the point where we had that room to sort of initiate something like that. So we did an initial assessment of the system. We looked at some of the statistics of Punjab. So very briefly, the internet penetration, like you mentioned, is very low. So in Punjab, 38.5% of the urban population have access to internet, and only 18.1% in the rural population has internet. Then we also looked at computer availability. So 44.5% has computer availability. But when we looked at the availability of television, that was a number that really stood out, and we found that around 90% of the urban population and 77% of the rural population has televisions. And then Pakistan has this system of cable network operators who develop very localized content, and their reach is very at a localized rural village level. So we essentially tapped that, and it required a lot of mobilization at the government level. So we engaged our information and technology board. They developed 13,000 video lessons using some of the content that was historically available in the public domain, but there's a new content that was developed. We sort of made connections with the private sector as well, because there's a lot of private sector entities who have been developing in the digital market, and we sort of developed those collaborations. And within 10 days, we initiated a cable TV channel, which was going to be projected across all cable TV networks. So around 1,400 cable TV networks were brought on board within a span of 10 days. We developed a website to ensure that anybody who has internet access can always go back to a website and look at the content. And then we also developed a mobile application. So the idea was to cover all different channels to make sure you reach as many children as possible.
So Abdal, 10 days, 25 people on this collaboration, in a country like all countries, where government sometimes resists having others swoop in and do the job that they're supposed to do. You were somehow able to bring government, the private sector, civil society on board and get them focused on this audacious undertaking. How'd you do it? What were the skills that you employed and that others brought or taught you?
I think it's very interesting. I still remember my boss called me one night randomly on, it was 19th of March, and he said, we have to do this because somebody has told me this cannot be done. And I said, right, I'm on board. I think the trick is that you sort of believe that this is something that is important and it's important for the greater good. The other something that I actually learned during Acumen sessions is that you create this common purpose. So you help people understand that this is for the greater good, because the issue is that at times uh, it required a lot of effort. Don't get me wrong. It was 16 hours a day, 18 hours a day for these 25 people. It required engaging people all across the system. So getting people on board on each of these districts. So massive mobilization. 3,300 community mobilizers were sort of mobilized to sort of download content on a weekly basis, give it to the cable channels. How you do it is, I think you sort of create the sense that this is important largely because of these children. And look at and this was the pitch that we remember we used to make in the beginning, because people used to tell us that it's not worth it, it's not going to reach everyone. And we used to say that out of 12 million, imagine if only 1 million children get it. The bare minimum, imagine the bare minimum. That it's still worth it, because if those 1 million children who are not going to learn anything in this time, because we're in a society where only 4% children have literacy and numeracy texts available at home.
So Abdal, so one of the things is vision and purpose and continuing to remind them. How do you get people to sit at the table who don't want to be at the table necessarily with each other, who are bringing these biases in, and getting them to work very, very quickly in the way that you did?
I would actually throw back something that was discussed in Acumen session. It was powering with and powering over. And I think when you're in the government, there are certain people you just have to power over. It's as simple as that.
But that's what you learned in Acumen?
No, that's not what I learned. That's what I learned at the government. The government, Acumen taught me with powering with. So I think what you do is that you ensure who are the key decision makers. You sort of create that buy-in at that level. The other is you use empathy and use you create the sense that this is actually for the betterment of the children, because nobody's getting paid for this. This is the greatest positive from this entire intervention. Not a single rupee is being spent. Everybody is doing this pro bono, even to the point the cable TV channels are doing this pro bono. Now, how do you actually get them, what businesses, to run something like that? I think what you do once again is that you create this sense of communication, and it needs to come from the ownership at the top. So what we did that we convinced first the ministers and the chief ministers that this is important, it needs to be done. Once that, and we showed them that we'll do the legwork. Once they were engaged, we started creating a lot of mass communication through social media, through print media, that these children are at home and they need to be given opportunities to learn. And this is where so I collaborated with another Acumen Fellow, Daniel, who works in this digital content firm. We work together very closely to figure out the messaging that needs to go out to sort of create that sense of purpose. And that messaging actually helped a lot. There were still some people who weren't convinced. There's still certain people who are still not convinced. Those are something that you then sort of make sure that you slowly, steadily bring on board. The numbers that started coming in, they were healthy enough to sort of project that this is working. So now slowly, steadily convince certain people. Some of them you really have to power over at times, and you have to sort of get them to do something that is their job description.
And so this idea of moral imagination, of have empathy and put yourself in another's shoes, understand where they're coming from, and help bringing them forward to get everyone focused on that mission. You said that people needed to see proof that things were changing. What proof do you have? And then quickly pivoting to what is going to stay in the future when you think about what Pakistan needs in terms of education, what you're already learning in this massive way. What will stay and must stay in the future? Niniola talked about collaborating not only at the national level, but globally. But just in a couple of minutes, if you would talk about that, and then I'm going to go back to you, Niniola, if you wanted to add anything to that. What will stay, must stay in healthcare, and then we'll close.
I think to answer the first question very briefly, stories. I'm an artist. I believe in telling stories, and this was something I was talking to Greta the other day. I think stories have immense power to sort of make people see and humanize stories. What we started doing was that we started picking up stories from a grassroots level. So children who were the very interesting sort of things that come. So there were children who had never been to school. The 5 million who were out of school children in Punjab is one of the biggest question marks on Pakistan's education system, as these children are still out of school. We started getting stories of those children learning for the very first time. We started getting stories of parents who'd never been to school. They started viewing the content because the first time it was available. And the best part is a lot of these parents and these children, the reason they couldn't go to school was poverty. They had to work in the morning. So we designed the content in a way that it has two slots, one in the morning and the other in the evening and late evening. So they actually had this opportunity to go back home and view some of this content. And those are the stories that actually started convincing people, to the point that we have these chief education officers. They're considered the hardest of the hardest to convince. They're the head of every district. They're considered the hardest of the hardest to convince. And last week we saw this amazing new change in which they're the ones who started forming teams at the district level, because we started documenting some of these stories and sort of sending them across, saying that look at this, the children are seeing it, there has value. I know we know that it's hard work, but still, it's still worth doing it. On the what's gonna stay, I would actually say this sense of possibility. That is something that I would like to, something that I wish would stay. And the second thing, which for me is very important, that this for the first time, this notion that people need to work in silos, that is broken down, and it's largely because there's a national or a global calamity and everybody is coming together. But why can't it stay longer? And it should stay longer, because you've seen that once people know that they all need to work towards a common cause, you can turn around a system in 10 days. I think that is something that's worth aspiring to, holding on to for a longer time.
Well, and that the government is behind this and is such an active partner and indeed is driving this. Is online education going to be more used in Pakistan if you were a betting man in the future?
So I'm not just a betting man. I try to take action on the things that I bet. So just today, we actually had conversations with multiple media houses who provide services and who have their own on TV channels on at least for 1 year sustainability. And then because actually a consultant by the World Bank, so I actually written to the World Bank that we're going to send in a proposal that we want to sustain this for at least 1 year. Let's see how it goes in a 1 year, and then take it from there. So we're very certain we're gonna keep this around at least for a year, see what impact it has, study it as much as possible, study the impact, evaluate it, and then make the long-term decision. But definitely, it's gonna stay. As long as we're here, it's gonna stay.
I have no doubt. It's very exciting to hear that, and also just like Nigeria, to see this common focus on a goal and how that is rallying people across the country is so inspiring. And as an American that is seeing everybody kind of in a free-for-all, state by state by state, it becomes even more inspiring. So Nini, last word. What's going to stay in healthcare in Nigeria that we can learn for, and what may not, but what will stay into the future?
I think for me, when I look at it, this is the first time that people around the world, but especially here in Nigeria, can really understand the importance of healthcare. It's been historically undervalued, underfunded, and attention has been paid in other places. And I think this is the first time that people are seeing how far-reaching a health crisis can be, beyond even just the loss of life. And so what I envision and hope that will stay is the sense of needing to build a resilient health sector, needing to be prepared, because unfortunately, COVID will not be the last. We expect that there will be other things that will come. But again, how do we take what we're doing now, learn from it, and become better, so that when those things come, you can have someone go to an airport or come into a hospital coughing, and be greeted warmly by somebody who's highly trained and knows what to do, and ensure that that person gets the best care possible and gets returned home to their family before, a massive outbreak starts. Those are the visions that we need to start putting in place now, to make sure that we safeguard our societies and our communities going forward.
Thank you. It is so incredibly inspiring and hopeful to talk to the two of you. You truly are manifestations of moral imagination in crisis, in the way that you partner with just real humility at recognizing what you are dealing with, a kind of crisis that is unprecedented, and yet you are both models of what is possible when you focus on the problem that you're trying to solve rather than yourself, get the right people together, and drive toward change. And we're going to be hearing a lot more from you in your countries and hopefully globally, because the world has so much to teach you. So thank you, the two of you.